Go.
My name is Ashley. I'm taking care of you. Can you please state your name and date of birth for me? Okay, thank you, Mr. Smith. Today we're actually going to be changing your dressing, so it should go by pretty quick. If you can just cooperate with me, we'll get done in a timely manner. I want to provide privacy. I want to raise the bed up to a working level. So we're just going to assume that I'm going to raise the bed up to a working level, and I'm going to lower the side rail. And I want to ask the patient their comfort level. Ms. Smith, how has your pain been? How have you been handling your pain since you had your last dressing change? Okay. So now I'm going to put on clean gloves. I verbalized my hand washing. I'm pretty sure I said that before. Clean gloves.
Remaining on the outside of the body. And now I'm going to put my baby pad, my
Expose just the wound. Give my patient as much privacy as possible. Okay. I'm going to peel the old dressing into itself. Before I take that off, I'm going to get my red biohazard bag. Okay. Take the bandage off. I'm going to assess for the amount of drainage, the color of the drainage, and the odor. There might be a copious or a scant amount of drainage. There would not be an odor if there was not an infection, but if there was, we would probably smell something. And the color, just depending on if it was infected or not, would be a light pink. So I would fold that into itself, and I would dispose of that. Now I would take this old dressing out and assess the wound itself for size. Looks about 4 inches long by 1 inch and a 1/4 inch deep. The color is a pinkish, reddish color, which is to be expected in a wound healing. There's no present odor and there's no drainage present. So I would take off my gloves, wash my hands, and then I would prepare my sterile field.
place the patient in a good position, face the side rails, and go back to a working height, and
Take this out, because this does not have to remain sterile. Put the shiny side down and tuck it under the patient's
I
water.
would then, for my hand hygiene, I would document the safety I did. I placed the patient in a lower position. I also
To remove my sterile gloves.
I closed the door and to provide privacy.
I would have to start the procedure over, but for video purposes, I'm just going to keep going. I'm going to assume that these are sterile. I'm going to remove.
I also did a wet to dry technique. I used a knee pad and I also used sterile solution.
Now I'm going to pour my solution. This is sterile water, normal saline. Take the cap off, set it on the side. With the label facing me, I would pour it without splashing. And then recap. And then I would put on my sterile gloves. Because I don't have a big enough table, I'm just going to go ahead and open my sterile gloves on top of my sterile field. But in a real situation, I would not contaminate my sterile field. Okay. And then I would this in my red bag. Hold it above my waist level. Everything should be above my waist level. And now I'm going to clean the wound. So I take a 4x4 gauze. I would dip it, wring it out, and clean it from cleanest to dirtiest. One swipe, tear it away. Do the same thing again. Dip it, bring it out. Got any dripping, cleanest to dirtiest on the other side of the wound. Throw it out. And one more time. Dip it, bring it out. And I just had some splashing on my sterile field, so I would need to start over, but for video purposes, I'm just going to keep going. And I would do the other side from cleanest to dirtiest and throw it out. Now I would measure my wound. Hold on 1 second, I forgot to get my measuring device. Okay. And this would be sterile. Okay, so I would hold it over my wound. And like I said, it's about 4 inches long, about 1 inch wide. Take that away. I would document that also. And then get a Q-tip to measure the depth. I'm going as lightly as I can and measure with my finger. And that would be against this. I wouldn't have thrown this away. It would have been 1/4 of an inch. So toss that and toss the old Q-tip. Now I'm going to pack the wound. So I take my gauze. I would open it up all the way. I'm going to dip it in my water, squeeze all the excess out, and then open it again. Again, I contaminated my sterile field by splashing, and I would have to start over. Okay, strain it out. I'm going to fluff it in my hand. Get my Q-tip. I'll come over here and pack it lightly. Not contaminating the outside area. Leaving air to breathe for the wound to heal. In a normal person, this would stick a lot better, but for video purposes, this is just going to stay right in here. So assume that this would be a real patient. I would toss this Q-tip. I would get the amount of 4x4s that I pulled off the wound to put on top of the new wound dressing. I would lay that across there. Get my ABD pad. Lay it on top with the blue side facing up. I would dispose of my gloves. And then I would get my tape. In a window pane fashion, I would take all 4 sides of the new ABD pad, being gentle on the patient's skin.
Hello, I'm Susan Estelina. Before we do that, I'm going to be taking care of you today. If you could just state your first and last name and your date of birth, and I will be checking your arm bands. Okay, thank you so much. Alright, today I'm going to be doing a wet to dry wound care. I'm going to be taking off.
And then I would get an extra small piece of tape to put on top of the wound and initial it, date it, and time it. So then I would clean up my area, dispose of all my equipment that I worked with, and I'm going to get the waterproof pad under the patient as well, clean his area. We'll dispose of this. Cover the patient up. Mr. Patient, did you take that well? Okay, good. I would raise the bed up to a working level. I would put the call light within reach. I would wash my hands, and I would document for how the patient tolerated it, the dressing I used, which was a wet to dry sterile solution, just change. I used sterile saline, the amount, the color of the drainage, the size of the wound. The safety precautions I took, and I think that's about it.